So I feel very passionate about this. I've been a paramedic for 23 years. I spent about 15 years in the fire service. And then the last 8 years I've been in public health emergency management. But during that time, I've deployed overseas to Haiti after the major earthquake there with 100,000 deaths, to Typhoon Haiyan in the Philippines with 8,000 to 10,000 deaths, and then to Nepal after the major earthquake there with 6,000 or 7,000. And each time I went overseas, I went with volunteer teams, and I saw how they worked. And so this is certainly a topic near and dear to my heart. So the question I'm going to start out with is, have you ever gotten a gift that you wouldn't necessarily have chosen, maybe not your style, nothing you would have picked out, nothing you're super excited about? Maybe it looks like this. But I'll add to this that after a disaster, if I were cold, if I were wet, and if I didn't have any clothes because my house was ruined, I would probably put this on. So I would urge you to be open-minded, to see that there is value here, that there are things that we could take from these teams. This talk came out of an experience I had in Nepal. I showed up in the airport with our team of about 15 people after traveling for 24 hours. We were just carrying our stethoscope, headlamps as we do. And there was a team of about 40 individuals in the most impressive jumpsuits. They had helmets, they had reflective tape, they had cool patches. And I came from the fire service, so that stuff's important to me. Like, wow, I wish I had a cool jumpsuit like that. This is not that team, but this is another medical team. But look at the capability. You can see that these people, it was a search and rescue team in the airport. We asked our local hosts, hey, what's their story? And he said, well, they've been trapped in the airport for 36 hours because the locals' emergency management doesn't quite know how to use them. And it's been 96 hours, and a lot of the search and rescue stuff is over. So how are they going to use them? What are they going to do with them? And I thought, wow, let me talk to our audience here, emergency managers. How are we going to use these teams? Because I will tell you 4 things. Number 1, if you have a big enough disaster, they're coming. Number 2, they don't know much about emergency management, ICS, the cluster system, everything else. So it's on us to reach out to them and integrate them. Number 3, don't be too proud to use them. Please say, we could probably use some help. And number 4, they're coming. If I didn't say that again, they've spent hours and years preparing themselves. They're volunteers. They've paid for their own plane tickets. They are going to come to your group. I threw up some logos up here. Some of them should be familiar to you. Certainly Doctors Without Borders, the Southern Baptists, I worked with them in Texas during Harvey. These are prestigious groups. You've seen them. They're probably well integrated, but I hope that some of these other groups you've never heard of. Alert International is a small Texas faith-based organization. Hope Force is another group. Tzu Chi is a Buddhist organization. Humedica is a German volunteer group. They are coming. How are you going to work them into your system? They're not just providing medical. There's water safety people. We've got communications. We've got drone experts. We've got building engineers. Now you may say to me, Mike, I can solve this problem and save myself the 7 minutes you're going to talk about this. We have laws and regulations that prevent doctors and nurses and EMTs and building engineers from working in our county or in our state unless they're recognized. This is where I would say we are all proud of what we do. We know we are capable. We have confidence. But admit that you might need some help. So I use hubris here instead of confidence, instead of pride, to say, okay, we could use a little help in this situation. So how can we work with these teams? There's a bunch of different ways. In the Philippines, they set up almost like a little kiosk at the airport, and they said, international teams, please check in here. Teams from out of state, please check in here. Give us your satellite phone numbers. Give us your radio frequencies. Give us this other information. They also had an incentive system where if you were an international team working with a local hospital, if you gathered medical records and the hospital turned them in after disaster, they got $50 or $30 a patient. I don't remember the exact number. Well, if you saw 1,000 patients in a week and that hospital turned in those medical records and got $50,000, that's some decent supply. So there was an incentive. The local hospitals paired people up. If you had a licensed doctor from the area, you paired them up with a doctor from the medical team. These are all areas ways you can do this. Why is this important? This is a very simple method of gathering disease information. These were, are we having GI diseases in the Philippines? Are we having respiratory illnesses? Are we having infected wounds? Well, I will tell you, these small teams, and this could work in any area, whether it's electrical infrastructure, roads, whatever area you're trying to track, unless you reach out to these teams and bring them into your fold, they're not going to know that they need to submit this data. And we're going to miss that disease outbreak. We're going to miss that electrical problem. We're going to miss that sewage problem unless you have reached out to them to bring them in. So I will also say that these groups are not perfect. I've been involved 3 or 4 international deployments now. Unless we're brought in, we're going to leave patients, and I've been working with my teams that I work with, without a good medical record. In Haiti, we had the most prestigious surgical teams from across the world come in. They did the external fixation, those kind of erector set looking fixes for your broken bones, and then they went home to their country. That's not appropriate. They gave people bags of pills with 1 at night, 1 in the morning written on them. Who knows what that pill is? There was no follow-up care. So I would urge you to reach out to them. Use your first responders. If they're doing their damage surveys after a major earthquake, after a hurricane, get them out in the field. Say, if you see someone from outside our area, get their information, bring them into the loop. You might say, Mike, I think they're going to do that anyway. I don't know. I was in the fire service for a long time. I don't know that I automatically would have put that information together, that if I saw someone from out of the area working, I would give that information back to incident command. But I show this last picture here. This was a young boy in Haiti who was pulled out of the rubble and then had pretty major brain injuries. He had burns. Actually, some of the rubble was burning when he was pulled out. But he kind of represents to me why we do what we do. I think the gentleman who spoke before me talked about his mother was involved. This is very important. This is very local. This is why we do what we do. And I'm so excited to be here. And thanks very much.